Friends, preventive health checkups have become a fashion these days. Hospitals, diagnostic centers, and insurance companies insist that people should undergo these health checkups every year. Not only that, they advertise that we will do 150 tests in 3000 rupees. And what tests they are doing? They do tests such as serum boron, serum strontium, serum cobalt, and whatnot. Are these health checkups really necessary? Or should we exercise some discretion in choosing the tests that we should undergo regularly? We must understand that there are many diseases which are silent killers. They are in your body without producing any symptoms for many years. Preventive health checkups help us to diagnose these diseases and start acting in time. To that extent, preventive health checkups are really useful. In today's video, we shall discuss the preventive health checkups, how one should choose the test that one should do regularly, and how these tests should be helpful to us in detecting imminent diseases, if any. I am Dr. Prasad, Honap, a consulting physician, and you are watching Let's Talk About Wellness. So, as we saw, preventive health checkup to some extent is necessary. But we must choose our tests in accordance with our lifestyle, our family history, our age, etc. So all tests may not be common for all people. There cannot be a package of preventive health checkup which many hospitals or diagnostic centers tend to offer. Many studies across the world have shown that indiscreet annual health checkups are unnecessary and put a burden on the patient and have no benefits to justify the cost. Many tests done under the garb of health checkups make no sense at all. There is also a great financial burden on the state health system. So how does one need to go about it? Generally, when a person is in 20s or 30s, no regular investigations are actually needed, unless of course some medical condition exists. For example, if the person has type 1 diabetes, then of course checkup is necessary for appropriate tests. But it is wise thing to check blood pressure once every year, even at the age of 20. One must check cholesterol once in 5 years, blood sugar every 2 to 5 years unless there is a strong family history. If there is a strong family history, then it should be checked every yearly. Eye checkup must be done similarly every 2 to 5 years. The eye checkup is not only for glasses but also for checking the pressure inside the eye, which increases in a condition called glaucoma. In 40s, in addition to these tests, women should also undergo mammography for breast cancer and what is known as pap smear, a screening test for cancer of cervix every year. And men should start checking the prostate specific antigen, which is a screening test for prostatic cancer. In 50s, both men and women should start doing bone density. Because after this, because of osteoporosis, even simple falls can lead to fractures. A person with a very strong family history of cardiovascular disease should also assess his heart status at least every alternate year. Similarly, a person with diabetes or hypertension should also undergo assessment of health of his or her heart regularly. This may include not only ECG but also stress test and echocardiography. Further testing should be done only if advised by your doctor. If these tests are normal, then these may be repeated every alternate years or every 2 years. After 60s, one should follow the advice of one's family physician or a consultant physician and decide what tests he or she needs to do regularly or how frequently. The gunshot policy adopted by the corporate diagnostic centers and big hospitals is not only not necessary but at times it puts lot of cost burden on the patients. And this only benefits the corporate diagnostic centers and not the patients. People have a strange policy. They will do vitamin D and B12 test, and when they find these to be very low, they will start making changes in their diet, start exposing themselves to sunlight, and ask the doctor to give them a pill. But why can't they make these changes earlier? Why can't each of us eat a balanced diet and expose oneself to sunlight, say between 10 in the morning to 1 in the afternoon, and do good physical activity regularly as a matter of habit? Preventive health checkups would be meaningful only if one is ready to adopt a healthy lifestyle. Friends, I hope this video throws some light on preventive health checkups and also makes you aware that sometimes preventive health checkups are essential to detect lurking diseases in the body and give us opportunity to act in time. If you like my videos, please like, share and subscribe to my channel. Let's talk about wellness. Suggestions and questions are always welcome. Thank you very much.